So in today's session, we're going to go through the JM Joint Mobility Diet in a bit more detail. In the session, we will cover some of the fundamentals of joint anatomy, a product overview, indications, benefits, composition, and the science behind our JM product. So just as a reminder of joint anatomy, two bones that meet, that's what we class as a joint. There is a gentle cushion of cartilage over the end, a bit like a foam pad. It has a spongy cushioning and it helps to absorb impact. We have cartilage that is made up of chondrocytes, which are your cartilage cells, and then there is extracellular matrix, which is a hydrated gel. The matrix is made up of proteoglycans, which provide compressive stiffness, and collagen, which provides tensile strength. When we're looking at the joints, it's all about balance. There are enzymes within the joint that are required to break down cartilage during normal repair, and then to ensure that there isn't an excess of cartilage breakdown. There are many conditions that can affect the joints, and we can break these down into nature versus nurture. And what I mean by this is nature would be things like bad breeding. So breeding from a male or a female where you know that there is a history of joint disease. And then nurture. These are the environmental factors. So it may be things like calcium phosphorus ratio during growth, if there have been accidents during that growth phase, if they are overweight, putting pressure on the joints, even down to things like the type of exercise. So if they've done lots of high impact exercise, such as running and jumping, that will have an impact on the joints, but especially if that type of exercise has been during that growth phase. So joint problems and their symptoms often come on gradually. You might start to notice some changes in gait, which is how they walk, occasional lameness and not wanting to do as much exercise as what is normal for them. As the condition deteriorates, you would expect to see an escalation of those symptoms, not wanting to jump or climb stairs, being consistently lame, difficulty getting up or sitting down, difficulty getting into their normal positions to go to the toilet, or obvious pain. So when we look at joint conditions, we know there are some risk factors. So you have age, size. We know it's more common in your large or giant breed dogs. Their weight. So this is a key one, as if they're overweight, that is putting far more pressure on the joints and can be a big part of the vicious cycle of joint deterioration. Okay, so let's have a look at weight in a bit more detail. So Purina did a lifelong study of 48 paired Labradors. One of each pair had 25% fewer calories versus their litter mate from 8 weeks of age and throughout their life. And this is how the body condition score system was created. The dogs that were fed the control amount had an average body condition score of 6.7 out of 9, whereas the dogs that were fed 25% fewer calories were on average 4.6 out of 9. When we look at the impact that this had on osteoarthritis, we saw that the dogs that were fed 25% fewer calories were older before they started to show signs on X-ray of osteoarthritis, whereas the dogs that were in the control-fed group were seeing signs much earlier. The yellow line on the left-hand side is showing the age at which the 25% fewer calorie group showed signs versus the blue line is showing the age for the control-fed group. Also, when you look at the control-fed group versus the lean-fed group, you can see that less of the lean-fed group were in the moderate to advanced stages of osteoarthritis. Alongside diet, we want to look at multiple factors when we think about the management of joint conditions. So, first of all, diet. So using omega-3 fatty acids, which are a natural anti-inflammatory, looking at antioxidants, specifically vitamin E and vitamin C to reduce oxidative stress. That's going to be helping to mop up those free radicals that would otherwise be causing damage within that joint capsule. we want to look at having a high protein diet to encourage and promote a lean muscle mass. We want to have lower fat because we know that being overweight is going to put additional pressure on those joints. And then we want to have a diet that contains good sources of glucosamine and chondroitin because these are the building blocks of cartilage. Now, when we look at joint mobility management, there are other treatments available. So you could look at things like hydrotherapy or physiotherapy, weight management clinics if that is an issue for that particular case, controlled exercise, so avoiding those high impact exercises like jumping or running, looking at joint supplements, and then there may also be the need for medicational management, so things like non-steroidal anti-inflammatories. So now we go on to look at the specifics of our joint mobility diet. The great thing about this diet is you can use it proactively or reactively. What I mean by that is it can be used for a dog where their breed is predisposed to joint issues, for example, German Shepherds, Labradors, breeds like that, or you could be using it reactively for dogs that are presenting at the practice with lameness or altered gait. This product has feeding guides in the manual for puppy growth, adult weight loss, and senior. Okay, so we've touched on the nutrition behind our joint mobility product in relation to the increase in omega-3 fatty acids, the antioxidants, specifically vitamin C and vitamin E, the high protein to support lean muscle mass, the low fat to reduce pressure on the joints, and the glucosamine and chondroitin, which are the building blocks of cartilage. There are also other benefits associated with the JM product. It is clinically proven to improve mobility and quality of life. It has a high protein to fat ratio and moderate fat to help maintain lean body mass suitable for all life stages as well. So we have the details of the composition and nutrient values within the product. Further detail can be found within your veterinary product guide, which we will often refer to as a VPG. This diet has been proven to support dogs with decreased mobility. It helps to maintain an ideal body condition score from puppy, which we know is key in the reduction or delayed onset of osteoarthritis. And this is just referencing that same chart that I took you through earlier, which shows that we can see that dogs with an ideal body condition score are much older before there is any radiographic evidence of osteoarthritis. And this is why it's key to think about joint health and osteoarthritis ahead of any of those clinical signs showing and thinking about it from a much earlier stage than we would routinely consider. Okay, so now let's go into some of the specifics about the blend that we're using. So when you look at omega-6 fatty acids, they often come from meat or chicken fat and vegetable oils, and these are classed as pro-inflammatory. Whereas omega-3s that come from fish and linseed oil have anti-inflammatory properties. Feeding more omega-3 fatty acids results in more omega-3 fatty acids ending up in the cell membranes. So think of you are what you eat. In a dog on a normal diet, available phospholipids in the cell are predominantly omega-6 fatty acids. In osteoarthritis, COX-2 enzymes break down fatty acids in the cell membrane, such as the omega-6 fatty acid arachidonic acid, and that leads to an increased production of PGE2, which then leads to an increased production of MMPs, which further break down that cartilage. Feeding a diet that's rich in long-chain omega-3 fatty acids, specifically DHA and EPA, alters the substrate available to the COX-2 for metabolism. So you have more long-chain omega-3 fatty acids that are then incorporated into the cell membrane. That COX-2 converts EPA, so the omega-3 fatty acid, into the less inflammatory prostaglandin PGE3, resulting in less of the pro-inflammatory PGE2 being produced. So in summary, omega-6 fatty acids are pro-inflammatory, whereas omega-3 fatty acids have anti-inflammatory properties. In osteoarthritis, the COX-2 enzymes break down fatty acids into the cell membrane, leading to an increased production of PGE2 when omega-6 fatty acids are broken down, which then leads to an increased production of MMPs, which further break down the cartilage. But if you feed a diet that is rich in omega-3 fatty acids, that alters the substrate available to the COX-2 for metabolism. So you get more of those omega-3 fatty acids incorporated into the cell membrane. The COX-2 then converts that EPA into the less inflammatory prostaglandin PGE3, resulting in less of the pro-inflammatory PEG2 being produced. So as we've touched on earlier, glucosamine and chondroitin are the building blocks of cartilage, and when supplemented, they help to support healthy cartilage and the repair of the cartilage. They do have some anti-inflammatory properties as well, and so therefore it'll have an additional benefit from that perspective. So we have antioxidants, specifically vitamin E and vitamin C, and they help to reduce the oxidative stress within the joints. So they will be mopping up those free radicals that would otherwise be causing damage within that joint capsule, that would cause further deterioration of that joint disease. We want the diet to contain a high protein to calorie ratio while also being moderate fat, as we know that high protein promotes lean muscle mass and low fat because we know that being overweight puts additional pressures on the joints. The study that we can see in the chart below showed the difference that was seen in dogs where they were fed a diet with 20% protein content versus a diet with 30% protein content. And as you can see from the chart, the dogs that were fed the higher protein diet not only had a higher fat loss, but they also lost less in the way of their lean muscle mass, which is really important for these animals. We also assessed something called force plate analysis, and that's looking at how much weight those animals were willing to bear and put through their limbs. So it's effectively a very fancy weighing scales that measures how much weight they're willing to put through each of the limbs, and we saw improvements within 10 days. The really nice thing about this is it highlights to both you and the owners just how quickly you would start to see the benefits of this diet. We also did a substantial study involving 146 dogs, and there were some really significant results. So after 1 month, 79% of the owners and 82% of the vets saw an improvement in the dog's mobility. And actually after 2 months, 90% of the vets and the owners saw an improvement in the mobility. So again, coming back to a time frame perspective, it massively helps from an owner education point of view to say that actually if the diet is going to help and support that animal with its joint disease, you will see that improvement within 2 months. So this is really nice because actually what we saw is that not only were we seeing improved gait, but we were seeing improved quality of life. And so this is something that's really important because it means that the animals were having a much better time once they were on this diet as well. So we also need to think about, there are times where we need to consider our obesity management diet. We know there is often a link between dogs that have joint problems and dogs that are overweight. So for these patients, I always talk about you need to look at what the primary issue is. So for example, if it's a dog with joint problems that are being exacerbated by the fact that it's overweight, then you may lead with the joint management diet, but feeding at the weight loss feeding guide. Whereas if that animal was overweight and that's putting pressure on the joints, you then may prioritise an obesity diet to support the weight getting off, which will then reduce the pressure on those joints. So when we look at the OM, it has many benefits to support these patients. So it has high protein to promote fat loss while maintaining lean muscle mass. It supports the glucose control, so we get that nice slow and steady release of energy. It is low fat, as we know fat is the highest energy producing nutrient, and it's high fiber, which helps with that feeling of fullness. So with these patients, one of the things that we often find is that having a diet that contains a blend of complex carbohydrates and higher fiber will help them to feel fuller for longer. So thank you for taking the time to listen to this training session. If you have any questions or you need any support on the JM or any of the other Purina diets, please reach out to the Vet Tech line at purina.nestle.com. You can use this for any general questions, or if you have specific questions around a case that is maybe more complex that you need some technical support with, please reach out to us and we would be happy to help. Have a great day and thank you for listening.